Good morning, and thank you, Dr. San Martin, for your kind introduction. I would like to thank the Florida International University for the invitation. It's always a pleasure for us to collaborate with you. And as Dr. San Martin mentioned, we have been collaborating closely with regards to the virtual course for self-learning of dengue, and it's been a very interesting experience. Without further ado, I would now like to proceed with my presentation. Can we show my slides, please? My presentation is regarding the situation of arboviral diseases regionally, and I have divided the presentation into two main aspects. An introduction to speak a little bit about the vector and arboviruses in the Americas, and then we will focus a little bit more closely on dengue and speak about the cases that we are seeing, the trends, the serious dengue cases and death, as well as the circulating serotypes in the region. Next slide, please. We will begin with this first point. To speak about dengue or even or various arboviral diseases, we need to first address the vector. This map shows us the probability of occurrence where the Aedes aegypti is present. The main vector involved in the transmission of dengue, chikungunya, and Zika in the Americas. As we can see in the map of the Americas, it's a vector that's widely distributed, and so where the vector is uh, there, the risk of the disease exists. We also have to mention that something that Dr. Raman already said in his presentation, the conditions that favor the distribution and development of this vector widely in the various countries of the Americas especially. And we have these areas of poverty that, of course, favor this distribution. People are forced to store water that are the breeding grounds for mosquitoes, and we must not forget the preferred area of living, which are these used tires that are they store water quite easily, and with any rain, these tires become ideal breeding grounds for these mosquitoes. And of course, the Americas that uh, make them high risk for the presence of the vector. And speaking of the vector, the diseases that they transmit, we will center on dengue, chikungunya, and Zika that are shown here on the slide in this figure. As shown, dengue, chikungunya, and Zika are almost omnipresent in all the countries of the Americas. We must not forget also that there are other diseases that are vector-borne, which are present in the countries of the Americas. And I mention this because when we speak of the work that needs to be done for surveillance and for control of these vectors, these are the same teams in the countries that do this work. There is no different team for each disease. Sometimes it's the same staff that is in charge of all these tasks, and this means a great load of work. Now, speaking about the burden or the number of cases that we have caused by arboviral diseases, and I'll center on these three again. This graph shows data of 2008, and we can see that in 2009, this was the first year where the that exceeded the million reported cases in the Americas for this group of diseases. But at the end of 2013, we saw the introduction of chikungunya, and later in 2015, we see the introduction of Zika. And we will all remember that when these diseases were introduced in the Americas, the distribution was really fast, sort of explosive. And it seems that then dengue was sort of displaced by these other diseases. Next slide, please. But when we look at in retrospect, we see that dengue was always there, in spite of the introduction of chikungunya in 2014. As we see in this graph, we still had a great number of cases of dengue reported even after the introduction of Zika in 2015, and which was quite explosive, most of the cases reported were actually dengue cases, and possibly there could have been in the beginning an over reporting of dengue cases because of clinical issues and um, the cross reporting that can exist between dengue and Zika. But dengue has always been maintained in its prevalence, and as you can see, as Dr. Roman mentioned in his talk, we see that dengue continues rising in the Americas. This slide shows the total number of cases of chikungunya for 2020 until the 38th epidemiological week. In the Americas, slightly more than 84,000 cases have been reported. Of them, almost one third or slightly more have been confirmed by laboratory tests. It is also important to note the reporting of these diseases by the various countries. Sometimes there's underreporting. Some countries are not reporting cases, especially in the Caribbean. This sometimes makes things so more complicated to know the real situation, the actual situation of what is going on. But most of the countries do have a good surveillance system with strict reporting and registry of these cases, and give us this information so we can have a regional analysis. As to Zika, up to the 38th week, a total number of 14,000 cases have been reported, slightly more. Of them, more than 1,800 have been confirmed by laboratory tests. As you can see in our figures from the various countries, we sometimes have some trouble with the submission of information by the countries, but especially from the Caribbean countries. So this, as I already mentioned, sometimes hinders or makes it difficult to know the actual situation of the various diseases. But we know that chikungunya as well as Zika, when present, the epidemics that they have caused and the experience that we already have in the diagnosis, clinical as well as laboratory diagnosis, this probably makes these outbreaks noticed, and I'm sure they won't escape the surveillance systems. So now we will focus on the situation of dengue in the Americas. This slide that I'm showing here summarizes the information. We will focus on three main indicators. We will speak of the number of cases shown in the bar graph to the left, and we will also focus on the severity of dengue cases as well as deaths caused by dengue. Now, looking at the number of cases, how many cases do we currently have in the Americas until week 38? Slightly more than 2 million cases of dengue have been reported. Of them, 929,000 have been confirmed by laboratory tests. We have 4,400 severe cases due to the disease, and 756 deaths have occurred. Now we can look at the bar graph. Although this seems a simple graph, but it shows a lot of information. That figure shows how this epidemics of dengue have a cyclic behavior. In 1981, we see a bar here that is quite clear compared to the other years, and that was the great epidemic of dengue in Cuba, which was hemorrhagic dengue that year. But then we can see that in 1985 there was another outbreak, and we can see that these dengue outbreaks occur more or less every 3 to 5 years. We also see that in 2010, this high number of cases occurred, and subsequently in 2013, for the first time, the number was greater than 2 million cases in the Americas of reported dengue cases. Then we see that in 2019 and up to date, that was the year with the greatest number of cases reported in the history of dengue. More than 3 million cases were reported. And something calls our attention, which is the abrupt drop in the dengue cases in 2016 and 17. The hypothesis of that sudden reduction in dengue cases is that there is a immunological cross-reaction that provides protection for those cases that already had Zika, and subsequently that confers immunity to them for vis-a-vis later dengue infection. So we must remember that Zika, with its explosion of cases in 2015 and 16, so all this population in the Americas created some immunity for a dengue, or in case of a dengue infection. That was reflected in those 2 years, but those 2 years were also useful to create a great number of susceptible people, and that immunity does not seem to be permanent, but rather temporary. That is why we had this great epidemic of dengue in 2019. And then in 2020, until week 38, we already have more than 2 million cases. The other important information in this figure is this line that goes from 1980. And what the line represents is the number of countries that systematically registered cases and sent us the information. And as you can see, that reporting registered dengue cases has been maintained. It has been quite constant, has been even rising and maintained in recent years. So until today, we have more cases, it's true, but it's also true that this reflects a better surveillance systems in the countries, and so they have better reporting, and that allows them to adopt the necessary interventions in a timely fashion. When we look at the cases of dengue by epidemiological weeks, I'd like to show here the last 3 years since 2018. You can see that at the end of 2018, there was a slight increase in the number of dengue cases, but in 2019, this was quite striking, and that was the great epidemic we had reflected during the first semester more markedly, but it actually was maintained in the second semester as well. What happened in 2020? This epidemic continued because epidemics don't stop at the end of the year. Of course, they don't really have a limit. What we can see here is the trend for the dengue epidemic to continue until 2020. But then there was a reduction, which was quite significant in the number of cases. And when we look at the information and look at an endemic channel, we see that this that we saw in 2020, where we have data until week 39, shows quite markedly the dengue epidemic. How, since the beginning of the year, we were always in the area of the epidemic. We must note something. After epidemiological week 7, there is a marked decrease in reporting of dengue cases. This was maintained quite constantly. We go through this area of alarm, and we're now in a safety zone. Now, what could explain this behavior? What was different this year? This year, as we all know, we have the presence of COVID-19, and this calls our attention. The cases of dengue in the region of the Americas started to decrease once the COVID-19 epidemic started in this continent. So what we see is, as the cases of COVID-19 increase in the Americas, then the dengue cases tend to decrease. So We believe, our hypothesis is that this is especially due to restrictive measures that were adopted because of the epidemic of COVID-19. People generally remained at home. People did not mobilize from one side to the other. So that, of course, seems to have contributed to a reduction in dengue, because although dengue is transmitted through the mosquito bite, is caused by the virus. And the virus, of course, needs to move from one place to the other as well. And it's not the mosquito that moves the virus, it's actually the people that move the virus from one place to another. And since they when they go to other places and the mosquito bites, then the disease is transmitted. Since this didn't happen because people were staying at home, this could have led to a reduction in number of dengue cases. We could also wonder that and postulate that maybe people did not go to the healthcare facilities, and so reporting decreased, and thus the reduction. So what would happen with the serious dengue cases? Of course, those have to eventually reach the healthcare facilities, because if they stay at home, they will die. So let's look at the following slide. This slide reflects, if we look at the green line and see the serious dengue cases, and in the bar graph, we see the serious COVID cases. So there's a sharp increase in dengue cases, severe cases at the beginning of the year, but then after week 10 or 11, sudden drop in severe dengue cases. So this also supports the idea that the reduction in dengue cases is quite real. So once the COVID-19 was introduced in the Americas, there is an actual decreasing trend in dengue cases. And this can also be confirmed if we look at the deaths due to dengue. The deaths occurred during this year. Most of them were occurred during the beginning of the year, but after the beginning of the pandemic of COVID-19 in the Americas, we see the same decreasing trend of deaths due to dengue. These indicators that are more robust to analyze dengue as a disease, and I'm referring to the indicators of severity and death, also follow the same behavior of a significant reduction. Where are the cases of dengue currently in the Americas? Brazil is the country with the greatest number of reported cases, and here we can compare the data after the end of 2019 with 2020 up to week 38. Brazil is a country that is almost half of the continent if we consider the territory. So the conditions are also favorable to have dengue in almost all its extension. So it's also the country with the greatest number of cases. But we need to see something that is quite striking. The second country in the list is Paraguay. When comparing the data of 2019 and 2020, we see that the increase was quite dramatic. And what happened is that Paraguay had one of the greatest epidemics of dengue in the history of the country. Another country with a great epidemic has been Bolivia. So we see in this graph the countries of the Americas with the largest number, with the highest number of cases, and this is the reported cases, number of reported cases. Although the epidemic began in 2019, it still continues until at least the first 2 months of 2020. And if we look at the incidence of dengue cases in selected countries, the list changes slightly. And here we see that the Caribbean countries mainly, and the French territories that currently have a significant increase in the incidence of cases of dengue. Saint Bartholomew, Martinica, and Saint Martin are now having an important increase in dengue cases, speaking in terms of risk of incidence. And here we also see Paraguay reflected here, which was the second country with regards to number of cases. Now we look at the other indicator where we want to focus our attention, and that is first to the severe cases of dengue. This bar graph shows three important data. In the upper panel, we see the proportion of severe cases of dengue, i.e., how many of the total number of registered cases of dengue, how many of them are actually severe. If we look at the middle panel in orange, we see the number of severe cases of dengue. And in the lower panel, we see the total number of dengue cases, just to give you a context of how the cases are behaving regarding severity. And here we see that Honduras is the country with the greatest number of severe dengue cases in the region, in spite of the fact that it's not the country with more total cases of dengue, which continues to be Brazil. If we look at Brazil, Brazil is quite to the right side of the figure. So in terms of proportions, it's not the country with the highest proportion of severe cases. Now, the question that arises is what happens in Honduras? Why so many severe cases of dengue in Honduras? And what we have seen with the authorities of the countries as well is that there is a problem in the classification of severity of the cases. Currently, dengue is classified as without signs of alarm, with signs of alarm, and severe dengue. The one with or without alarm signs is not actually a severe case, but what we've seen is that in this country, what happens is that they're including in the category of severe those that are dengue with signs of alarm. This is somehow triggering the indicator with the right proportion of severe cases. Next slide. If we now address the other indicator that I mentioned, and we'll refer here to the death and the fatality of cases due to dengue, this is the number of deaths from the total number of dengue cases. We can see the list of countries here, and there's a number beside them. That is the absolute number of dengue cases. And in the bar graph, what we see is the fatality rate. So in Venezuela, the one with the highest fatality rate, however, it's not the country with more a number of deaths of cases due to dengue. And Roman mentioned in his presentation this. In general terms, fatality cases due to dengue is less, the rate is less than 1%. So we are saying that in relative terms of the number of cases, there are few number of deaths related to the disease. And this is, of course, reflects the care of such cases. So in those countries where there are few cases of dengue, but that have few death, of course, the fatality rate would be high. And this is quite common in the Caribbean countries, as we see here, for instance, in St. Martin's Island, where there's only just one death, but fatality rate was higher than that of Mexico, with has 28 deaths. But of course, is compared to the number of cases of dengue that they have in the country. So in this graph, we can see that aspect, which is a relative measure, but we can also see the absolute numbers as well to understand the countries that have a higher number of deaths, but also those that have the greatest risk of dying due to the disease or fatality rates. I would like to show again this figure that I showed before. Speaking of the three main indicators, we see that in the upper right panel, what this yellow or green line is showing is the proportion of severe dengue. And we see how the severity of dengue in the region has been behaving. And we see that since 1999 or until 2010, the trend was towards the rise of the proportion of severe cases. But after 2010, we start seeing a descent or a trend towards descent of severity. And this is something that we also see in the lower panel, which shows the lethality or fatality rates there was a trend until 2010 towards the rise, but since 2010, we are seeing a trend towards the drop in cases, or rather in fatality rates. Since 2009, what happened is that they adopted the new classification of severity for dengue. And this classification led to a change in paradigm, which was to focus in the management of dengue cases from the primary care level on through initial recognition of alarm, signs of alarm. And so that helped to prevent the progression of cases towards the severe form of the disease. That's the best way of avoiding the death due to dengue. In the past, the way to avoid the death due to dengue was based in intensive care measures. But in fact, this new classification, which is quite clinical, helps physicians to prevent the severe cases. So we are acting in more preventive manner rather than a reactive manner when we have dengue case. And this has worked quite well in the region of the Americas. Of course, this also has to go hand in hand with clinical training programs to giving support to the countries to identify the challenges and also to identify their strengths and be able to translate this experience and share it among countries to better learn about how to manage the cases of dengue. Next slide, please. I think I have only 2 slides left. We cannot finish without mentioning the serotypes of the virus. And we see in the map shown on the left panel, the first one has 4 columns. The first column represents serotype 1, the second column serotype 2, the third is serotype 3, and the fourth column is serotype 4. And that figure also has 3 rows, and there we see the years 1995, then we have 2005, and finally 2018. So what do we see here? We see that the serotypes have been increasing in their presence throughout time. Dengue 1 and dengue 2 have been serotypes that have been quite frequent in the Americas. Nonetheless, serotype 2 and serotypes 3 and 4 that began with presence in only a few countries, we can see how as time went by, the presence has been increasing in the countries of the Americas. If we now look at the right panel, we see the figure that shows how many serotypes are circulating simultaneously in the same country. There are several countries that have at least 2, 3, or even some 4 serotypes that are circulating simultaneously. What does this represent? This means a greater risk of epidemics in the countries. It also means a greater risk of severe cases because we know that one person who has been infected by a second serotype of dengue will, of course, be at higher risk of having a severe form of the disease. And the next slide, which I believe is the final one, shows per country, what are the serotypes that are circulating? As I said, we have countries that have 2 or 3 serotypes that are circulating at the same time. This is dengue 1 and dengue 2 are always the most frequent serotypes that we find in the countries of the region. But we also see dengue 3 and dengue 4, which we have seen that dengue 3, when it causes epidemics, has a great affinity for various organs. And then we start seeing those cases that were called as atypical cases formerly. But when they do occur, we see that they are more linked to this serotype. Next one, please. With this, I would like to finish my presentation on the context of what is now occurring with dengue in the region. All this information that I've presented is available in the website that is shown here in the platform of Health in the Americas, www.paho.org /PLISA. And I invite you to please look at the platform, and I hope that we can present you the platform live at some other